I am talking about two drugs, aducanumab and solanezumab. They are two drugs that are proposed for the use of treating Alzheimer's disease. So we'll start off with what is Alzheimer's disease. It is defined as an irreversible progressive disease of the brain that results in declining cognitive function and eventual death. So if we look at this necropsy of a brain of a person with Alzheimer's disease, we see that there's neuronal atrophy, which we will get into later. But overall, it's going to cause memory deficits, impaired reasoning, and decreased language abilities. It is also known as the leading cause of dementia, which dementia is the inability to think, reason, and remember. So a lot of patients that develop Alzheimer's disease will eventually in the later stages develop dementia as well. And then finally, it is the sixth leading cause of death in the United States, and it's actually proposed that it might be bumped up to number 3 death in the United States, right behind cancer and cardiovascular disease. And then overall, 5.3 million people a year are diagnosed with Alzheimer's disease, and that is expected to triple by 2050. So it's pretty serious. The science behind Alzheimer's disease, there's two proposed proteins that are highly associated with the development of this disease. The first one, which is going to be the focus of our drugs today, is the amyloid beta protein. That is pictured right here. It forms when amyloid protein fragments are not broken down properly. Amyloid protein is commonly found in the brain, but when it's clipped off of different structures, if the fragments that are clipped off aren't broken down properly, those kind of aggregate. It's considered a sticky protein. You can kind of see here there's a lot of functional groups coming off of the amino acids, so that allows the protein to form chemical bonds with other proteins, hence the aggregation. And amyloid protein, or amyloid beta protein, is thought to be the main component for Alzheimer's disease. The production and deposition of these beta proteins is going to be what is going to cause the most damage. And then finally, it is seen to trigger the formation of tau proteins, which is the next protein that we're going to look into, which is a microtubule binding protein. So in normal cells, tau protein is going to hold up the integrity of the microtubules. So if you have microtubules going like this across the cell that are used to transport proteins and nutrients and other things to adjacent cells, there's these tau proteins that are structured in between these microtubules to hold them up. When these tau proteins are damaged, they form tangles of the microtubules, so these microtubules fall in on each other and no longer function as a transport system in the cell. So, pharmaceutical solutions to this, as we talked, or as I said, we're going to focus on aducanumab and solanezumab. These are both passive immunotherapy drugs that are used, and the action of these drugs uses monoclonal antibodies, I apologize, and that's the main focus of the drugs. So these monoclonal antibodies are formed through culturing antibodies from a normal cell, injecting those onto in this case it's a tumor cell, but it would be onto those beta amyloid plaques. And then once those antibodies are formed, those are harvested and injected as a therapy agent. These antibodies are going to trigger the microglia cells to break up these amyloid plaques. So this is an amyloid plaque, and those microglia cells are going to attack. The microglia cells are kind of like the brain's cleaner cells. So they go around and pick up fragments of what shouldn't be there, and they digest them and get rid of them.
That's where our memories go.
Yeah, right? And so when we look at these drugs individually, we see a couple different distinguishing characteristics. Aducanumab is produced by Biogen, whereas solanezumab is produced by Eli Lilly. Solanezumab it's going to target the monomeric forms of the amyloid plaques. So the monomeric forms of the beta amyloids, it's just going to be that figure that we saw earlier, where it's just one protein as itself. Whereas aducanumab is going to bind to the soluble oligomers of that protein, kind of in the steps to creating a plaque, and then it also binds to the plaque itself. Solanezumab failed 2 rounds of its phase 3 trials, so it's kind of, they're kind of taking a little break to work on that, because it did show benefits for patients who do have earlier stages of the disease, but obviously failing these 2 phase 3 trials is not going to be good, so they've really got to work on that. Whereas the aducanumab is actually showing better results, and it's more promising. So they're actually skipping phase 2 studies and going right into phase 3, and the results are showing statistically significant results. And not only does it decrease the amyloid plaques found in the brain, it slowed impairment in the early stages of the disease, and it was found to be dose dependent. So when they used higher doses of it, there was more plaque reduction, as you would think. So now in the phase 3 trials, they're going to see how safe that dose dependency is. And then it also did improve cognition in patients with the disease, so that's good. So that's why they're really trying to urge that into the market. So, and then in the end of my article, it kind of focused on some of the other approaches by pharmaceutical companies into targeting Alzheimer's disease. These were a little bit more shaky in their roots. So the crenezumab by Genentech, that's thus far it's failed 2 of the phase 2 trials, but it did show promising results in people with early stages of the disease. And then the tau-Rx therapeutics is going to be focusing on the tau protein as opposed to the amyloid beta. And it uses a methylene blue LMTZ in phase 2 to delay the progression of the disease. So interesting to the amyloid and the tau protein. The amyloid leads to the tau, but there's no therapies suggested yet that are combining both methods of treatment. It's thought that, you know, if you attack the amyloid beta proteins aggregates first, you will kind of decrease the amount of tau that are going to be produced because they lead to the tau. But it's kind of tricky to use any of these drugs because Alzheimer's disease develops 15 years prior to any symptomatic presentation, like in a patient. So before you even know that you have the disease, before you even get the cognitive decline or the memory loss or language troubles, you've got those plaques forming in your brain. It just takes 15 years before it's going to actually invoke a response. So that's where genetic testing is going to come more into play, as far as if you've got a predisposition to the disease, using a drug like this early on is going to cause the best results. But as I said in the beginning, it's an irreversible disease. So any of these drugs are going to try to slow the progression of it, but nothing's going to stop it. It's still going to have its effects on the brain, and it's going to cause an early death and brain atrophy. But if you can slow down the disease at all, that's the main target. So, I don't know.
It's neat. Amazing.